Now is Dr. Lipi Roy, Medical Director of COVID Isolation and Quarantine Sites for Housing Works in New York City. She's also been volunteering with the city to help vaccinate hundreds of New Yorkers. This weekend, her shift was canceled because of a lack of vaccine supply. Lipi, help us understand this. I'm not understanding how this is going on.
Good morning, Ali. And you know, I'm always happy to talk to you, but you're absolutely right. The only reason I was able to talk to you today was because my shift at one of the New York City vaccine hubs was canceled. And in fact, you probably saw you see images of me there with Dr. Paul Chu, who also volunteered, and that's Dr. Finkelstein. We all are doctors in New York City who volunteered with the Medical Reserve Corps in an effort to vaccinate as many New York City healthcare workers and now elderly and other eligible New Yorkers. But the headline came out earlier this week that 23,000 vaccine appointments were canceled because of an insufficient supply. I'll tell you what's promising. What's promising is that at least here in New York, we have plenty of volunteers and other public health workers who are willing and able to help out in the effort. But Ali, without sufficient vaccine, and not just New York, but really every city, county, state in the United States, we are not going to be able to fight this pandemic.
I want to take a look at some of the things. There's a lot of stuff that the Biden administration has unveiled or unrolled or announced in the last couple of days. Just a few of these points begin with invoking the Defense Production Act. That part of that is enabling the vaccine and the supplies required to get that vaccine to people, requiring companies to manufacture that. Do you see that helping, and how quickly can it help?
Yeah, so I know that you and I have been talking about this pandemic, COVID-19, even before it was called COVID-19, the coronavirus, back in March, in April. Yep. And back then you heard people like me and my fellow public health advocates talking about activation of the Defense Production Act for gloves and masks, which, by the way, we're still in shortage of and still are absolutely mandatory. And we're talking about testing kits, which, by the way, still isn't where it needs to be as far as nationwide testing, and now with vaccines. So I have 5 words. This is why leadership matters. Already in the first, 72 hours of his presidency, Joe Biden has already talked about the Defense Production Act. He's been talking about 100 days of masking. He's clearly listening to evidence-based public health experts and medical experts, and you can tell by his team, his advisors, he's surrounded by the best. It's going to take time, but activation of the DPA is certainly a move in the right direction, Ali.
What do you make of this plan that they've got to get 100 million doses out, 1 million doses a day? You know about, like Dr. Ayla Stanford, who we just quoted before you know about the actual stuff that happens on the ground. You said we've got the resources for it. We've got the people to do it. Does this plan look like it's going to get us there?
Yeah, well, you know, I'm extremely fortunate to be living in a city that has one of the oldest and most reputable public health departments in the country. However, other areas, other rural communities that just simply need more resources, that's where we need to pay attention. Communities of color where they just don't have the staffing or the support, that's where we need to focus attention. And as you know, Ali, it's not just the actual medication or the vaccine, it's the syringe, it's the swabs, it's gauze, it's alcohol, it's all these alcohol swabs, it's all these other little steps. And then the organization, I mean, they had an algorithm for each pod unit leader, the vaccination unit leader, the medical greeters, the flow people. I mean, it's a considerable amount of organization that needs to happen from the federal to the state to the local level. That's what really needs to happen, Ali. But I am hopeful with this administration that that's going to happen.
Well, Lipi, I enjoyed talking to you, but I hope I don't get the opportunity to talk to you because your shifts for vaccinating people were canceled again. Let's hope that gets back on the road, but always good to see you. Lipi Roy is the Medical Director of COVID Isolation and Quarantine Sites for Housing Works in New York City, joining us this morning because she can't vaccinate people this morning.